Welcome to this presentation. My name is Samad Hamidi, and in this presentation, I will share findings from a study titled Parent-Child Interaction Therapy for ADHD in Iranian Families, Navigating Cultural Barriers in Child-Directed Interaction. Attention Deficit Hyperactivity Disorder, or ADHD, is a common condition that affects children globally, and parent-child interaction therapy, or PCIT, has been shown to be an effective treatment for managing disruptive behaviors in children with ADHD. However, cultural differences in parenting styles, communication patterns, and expectations regarding child behavior can present unique challenges when implementing PCAT with Iranian families. The aim of this study was to explore how cultural barriers, especially the tendency of Iranian parents toward greater guidance and control in their interactions with children, may impact the effectiveness of the child-directed interaction or CDI phase of PCAT. We also sought to identify the challenges as well as the necessary tailoring and adaptations to ensure that this intervention is not only as effective but also culturally sensitive and acceptable to Iranian families. PCAT is a highly effective evidence-based treatment that strengthens the parent-child relationship while addressing behavior problems in young children. PCAT has two phases. The first is child-directed interaction, or CDI, where the parent follows the child's lead in the course of play. The focus is on reducing negativity and building warm, positive communication. Parents are coached in specific CDA skills like using labeled praise for positive behaviors, describing the child's actions, reflecting appropriate talk, and avoiding questions, comments, and criticism. Once parents master these skills, they move to the second phase, parent-directed interaction, or PDA. In this phase, the parent takes the lead using clear, direct, positive, and polite comments one at a time, often with praise or explanations. PDA also includes consistent follow-through, labeled praise for obedience, and a structured timeout procedure guided by evidence-based strategies. Live coaching is provided through a bug in the ear device from behind a one-way mirror in both CDA and PDA phases. Treatment continues until the parent has reached the goal criteria for both the CDA and PDA phase and the child behavior is within the normal limits. Our study involved 26 parents, including 7 fathers and 19 mothers, and their children aged 3 to 7 years, all diagnosed with ADHD. At the start of each session, parents completed the Iberg Child Behavior Inventory, or ECB, which measures both how intense the child's behaviors are and whether the parents see those behaviors as a problem. Additionally, we coded the quality of parent-child relationship using the dyadic parent-child interaction coding system, or the PICS, to assess treatment progress. Results showed a gradual increase in those skills such as praise, descriptions, and reflections, and a slower decline in don't skills, particularly questions and comments. Iranian parents often struggle with following the child's lead, tending to be more directive and controlling in play. Asking questions and giving comments were two prominent aspects of Iranian parent-child interactions in our study, which made it challenging for parents to reach the goal criteria in the CDA phase. In many cases, the tone and manner of speech led parents' utterances being coded as questions and comments. Since parents were not fully aware of these behaviors, which are common in everyday Iranian parent-child communication, their reduction took more time and posed a significant challenge in the course of the treatment process. In contrast, parents were more aware of their negative talk toward the child, which led to a quicker reduction in criticism compared to questions and comments. These two charts show the effectiveness of PCAT in reducing scores on the intensity and the problem skills as reported by parents. As shown in the table, the treatment was effective in lowering scores on both skills. Interestingly, although parents in our study reported a decrease in their child's behavioral problems over the course of treatment, they still demonstrated a high sensitivity in identifying and labeling certain behaviors as problematic. Moreover, some of these behaviors were developmentally typical, suggesting that cultural norms and expectations may influence how Iranian parents perceive child conduct. In other words, Iranian parents tend to have a low tolerance for the child behaviors that may, in fact, fall within the normative range. The study showed that PCIT can reduce behavior problems in young children with ADHD in Iranian families. We also found that many Iranian parents have a hard time letting the child lead while playing, and often use too many questions and comments in an effort to guide or control the child's behavior. This makes it more difficult for them to learn the CDA skills. These findings suggest that although PCIT works well, it's important to make small cultural changes to the way we teach and coach these skills so that parents feel more comfortable and the treatment becomes even more effective for Iranian families.